I work as a busy clinician. I have clinic 2 days a week and surgery as well. I teach residents and fellows, so I have primarily an educational role. I also work on our clinical system, so I run our EMR system as well as our image management system. And I do a lot of clinical research in the fields that interest me. I take my clinic as my research lab, and I use it as a place to ask hypotheses and to look out for new treatments, as well as to test new drugs and development and devices in development as well for retinal diseases. So we have a variety of different studies going on. They're both funded and non-funded studies. So we do a fair amount of pharmaceutical work. So we're doing some of the phase 2 and phase 3 studies for both diabetic macular edema as well as AMD. And we're also doing other investigational studies on our own, looking at retrospective studies of patients we've had in our populations. There's a lot of new drugs coming out for geographic atrophy and other disease states, and we're trying to understand how they fit into our practice, how many patients are out there, what the demographics looks like, getting a really good sense of that. And we're really able to do this. We have a lot of good big data element analyses in our groups. We have a variety of treatments for AMD, and they're quite good at what they do. They do increase visual acuity and do improve patients' quality of life, but the problem is they have to be given as monthly injections. So as part of this, the research I do, we look at longer acting treatments, sometimes drug delivery devices, agents that might be in combination given together to reduce the need of frequency of treatment. So these are really things that I think are really going to be beneficial for the patient at the end of the day, and hopefully improve the quality of their life by not coming in every month for treatment. I consider my clinic my lab, so I don't have to do two things, and having the ability to use my clinic as my research lab really makes it a lot easier for me to accomplish my goals, both from an educational perspective as well as from a teaching perspective. We try to do a lot of different things outside of our own clinic and areas. We publish a lot of our data, we go to meetings, we present our data at those meetings. We actually run our own meetings at the Cleveland Clinical Eye Institute, both before the before ASRS and before the ARVO meetings every year. And we have a really good level of education for residents and fellows at those meetings as well. There's some really great treatments coming down the pike for dry AMD. We're seeing a lot of complement factor inhibitors for that condition. And over the next few months to years, we're going to see the data from those studies emerge, and it's going to be really important to understand how they fit into our practice. And so we have a lot of hope for dry AMD. I think that's become a little bit of a larger issue for us now, because wet AMD essentially is treatable to some extent, albeit that it's a high burden of treatment. But for dry AMD, we still don't have a lot of treatments at all. Coming to a conference like this has been invaluable. You come to a conference like this, you can meet a lot of your colleagues who are into the same research work you're doing. Yeah, you get a lot of pearls. Even at my mid-career stage, I really learned a lot from my peers in this group. And so having presentations at the American Academy Subspecialty Day, in retina, there's some really great videos that come from that, and surgical techniques that I can use in my own practice starting next week. And really just a lot of good practical information. And I also find time to reflect on what I've done this year and maybe to do more things next year for people.